Let's discuss voice disorders. Another item is solely devoted to spastic dysphonia, which is also a type of voice disorder. But this, in this lecture, we're just concentrating on general voice disorders. Okay. Now notice I have shown this instrument here. Now, what is this instrument? This instrument is the laryngoscope we introduced down the nose to have a look down at your vocal cords and the voice apparatus. Okay. Of course, we first anesthetize it with a lidocaine afrin spray, which makes you feel numb for about an hour. And this spray makes the nasal passages widen. Okay. And then we introduced the laryngoscope through the nose and down above the soft palate, down into the laryngeal area. So, whom can voice disorders afflict? Voice disorders usually afflict professionals who use their voice, singers, teachers, public speakers, who thus, if they can't use their voice, they can't do their jobs. Okay. Now, when do we get worried? We get worried when there is hoarseness of more than 4 weeks. And especially if the hoarseness is in smokers. Why so? Because then we think of cancer of the larynx causing the hoarseness. Okay. So hoarseness of the voice in smokers of more than 4 weeks. We'll have to be especially open to the possibility of something growing down here, and which we'll notice, of course, by means of this, the laryngoscope. Severe voice changes can occur, such as strained, raspy, breathy, weak, higher or lower in pitch. Okay, the voice can be inconsistent. The voice can sound fatigued all the time. The voice can be tremulous, shaky. Especially happens in older people when the muscles to the vocal cords become weak. Okay. But if it lasts more than a few days, then we have to look into it. Okay. Of course, if we are old, it gradually declines. But if this occurs suddenly and lasts for more than a few days, it would be best to have the vocal cords looked at through this laryngoscope. The voice disorders may manifest as difficulty in breathing. Okay. There may be pain when speaking. Now, what could cause this hoarseness? The hoarseness could be caused by acute laryngitis, say in smokers, or suddenly smoke inhalation. People in fires and who inhale smoke can have acute laryngitis where the larynx is inflamed and all this apparatus, vocal cords can all be very inflamed. There may be vocal nodules, that is to say, due to misuse of voice or due to allergies, some tiny little nodules can form at the vocal cords and cause hoarseness. They prevent the vocal cords from shutting completely and thus cause hoarseness. There can be polyps here, or there can be cysts of the vocal cords. There can be precancerous or cancerous lesions. There can be nerve disorders. And there is one type of lung cancer which causes vocal disorders. That's because the recurrent laryngeal nerve hooks around the aortic arch down here and comes back to supply the vocal cords. So if you have lung cancer at the level of that hooking around the trachea, you can end up with hoarseness. That happens especially in smokers. There can be reflux coming up the esophagus and burning the arytenoids here. So they can't speak too well because all this is inflamed. Okay. Smoking, of course, causes inflammation. Allergies, thyroid problems, trauma to voice box can cause hoarseness. Thyroid problems too. So that is another thing we have to be vigilant about. Thank you very much. So these were just the telling you what the voice disorders could be caused by and how we examine.